everyone. You're watching News Epicenter with me, Marya Shakil. The year 2020 was one of disruption dominated by the coronavirus. But the first Sunday of the new year, that is 2021, brought us the news of two vaccines, Covaxin and Covishield, being given the green light for rollout. But as the announcement has brought hope to millions, not just at home here in India but across the globe, it has also raised many questions. Number one, Covishield bridging studies are still underway, while Covaxin is still undergoing phase 3 trials. These data gaps have started a political war over the vaccine rollout. The Congress has questioned the government, accusing it of a lack of transparency, adding that the rollout without completion of trials can be a major risk. Other parties like the left claim the rollout has been done for political gains, while some have gone several steps further. Samajwadi Party chief Akhilesh Yadav has said he will not take BJP's vaccine. Those are his words, quote unquote. The BJP has accused the opposition of insulting the nation's doctors and scientists, adding that the world is now looking to India for a solution. Many experts have told CNN News 18 that these vaccines are safe for use, as the government plans a pan-India rollout, which will be the biggest immunization program in the world. But should pertinent questions about the vaccine be a test of nationalism? Questions over data gaps are pertinent, as any safety issue will spark an alarm across the globe. So, is a greater review of the vaccine data the need of the hour before a rollout? Joining me on the show, Rashid Kidwai is a journalist. Rajiv Rai is the spokesperson of the Samajwadi Party. We'll be also joined by Guru Prakash in just a bit. I'm going to begin with you, Rajiv Rai. While it is okay to raise concerns about the process, but why should vaccines be branded like your party boss has done? Akhilesh Yadav has called it a BJP vaccine.
Number one, Akhilesh Yadav's statement today should have seen and heard in the details. Number two, it's not Samajwadi Party. You know, the vaccine ka guru, BJP ka vaccine, Pradhan Mantri ne do vaccine bana diya. Today, Yogi made a statement, पूरी दुनिया में एक वैक्सीन बना, हमने दो वैक्सीन बना दिया. Who is branding? Is it BJP or Samajwadi Party?
Akhilesh Yadav ne bola hai BJP vaccine. Nobody else did it. That is the reason why all this criticism is coming.
That's why I am telling you. Today Yogi said, पूरी दुनिया में वैज्ञानिकों ने एक बनाया, हमने दो बना दिया. Who is branding? Who told Modi is a vaccine guru? I mean, that man who invented fighter jet in the sky, the radar cannot trace. The man who invented nali ke gas se chai bana dega, he is the scientist. If he is the scientist for this vaccine, certainly we don't want to take.
No. Why are you trying to create this confusion? This is certainly an unnecessary confusion. You can raise questions about processes, but or about the data.
That was the very reason.
No, but there is a problem in this argument.
He was being sarcastic. I request you, please send your reporter. Ask them to go and have a look what is the arrangement they have made. That's
okay,
exactly his point.
Rashid, you know, we were hoping that the Congress party will be joining us in this debate, but they chose not to debate today on this topic. Rashid, the Drug Controller General of India approved vaccines, Covaxin and Covishield. This followed the green light that was given by a Central Drugs Standards Control Organization expert panel. A fact sheet with safety details will be provided to those receiving first lot of vaccines. These are crucial steps which have been followed. Then why should this chest thumping or vaccine nationalism, these phrases, be used by Congress leaders?
I think, Marya, it is very important and it's a kind of duty for opposition to be raising these issues. These are very serious matters. People do not know the elementary, the difference between what is a drug and what is a vaccine. And you see the whole concept of clinical trial, data efficacy and all. We must also hear what Congress is showing is of course relevant, but what Dr. Gagandeep Kang is saying, what Dr. Shahid Jamil is saying, what various pathologists are saying, and they are raising very important issues. See, they are questioning the process, they are questioning utterances. Now, both these things are not, spoken from a political platform. And I think politicians should, because when it comes to, because it involves millions and millions of people of India. So opposition should have a say. Why should the government of the day or establishment be judging them as someone who always questioning their patriotism? I think they are doing their duty, national duty, and it's government's
Okay.
job. It is the drug controller's job to explain, to convince. Because as I said, human lives are involved.
Guru Prakash, if the opposition has raised serious questions or concerns, I would say, over the grant of approval to Bharat Biotech's vaccine for restricted use, by saying it is premature and can prove dangerous, I'm trying to understand that why should they be forced to undergo patriotism test?
You see, Marya, opposition party are showing lack of vision, imagination, and leadership. The simple point is that they are not able to digest the stellar leadership which the Honorable Prime Minister has shown over the course of the last 8 to 9 months. It is a remarkable moment. A vaccine has come. It is an indigenous vaccine, grown in India, developed in India. Opposition party, by repeatedly questioning the nature of the vaccine, the nature of
No, I think what they are questioning, Guru, is the
insulting,
process.
they just,
Then
they are
they
just
should not be
insult,
dismissed
yeah.
as cynics, because there are other epidemiologists also who have said, I have no clue, never seen anything like that. That is Gagandeep Khan. She has also said, we look at Pfizer, Moderna, AstraZeneca, all of this has already been published in peer-reviewed journals. So question is being raised about data. So these are genuine concern and questions. Why should this be about whether you are an Indian or half an Indian or complete Indian at all?
You see, Marya, you should understand one thing, that the vaccine is not developed by BJP, as some of the Congress party leaders would like to believe. It is a joint effort of Oxford University and AstraZeneca, a joint effort of two developed countries, British and Swedish economies. And as I speak to you, I have a newspaper cutting in front of me which lays out the effective strategy of how they are going to roll out 1 crore vaccine to the health workers, and then the 2 crore vaccine to the frontline workers, and then gradually the 27 crore vaccine by the end of July. The government has a proper plan, a vision, a strategy, and an implementation which you would see by the end of July. The government has already appointed almost 1,14,000 vaccinators. The government have been on their toes since the last 8 months. So I seriously don't see any argument in this unscientific, illogical, irrational statements being made by the Congress party.
Okay, so what about the statement being made by Rajiv Rai? Rajiv Rai here says that it is the BJP which is now trying to indulge in chest thumping, that हमने नहीं एक नहीं दो vaccine हो गया in India में. That is the reason why Akhilesh Yadav and others are raising the question. Guru.
You know who is in alliance with Akhilesh Yadav? Who joins Akhilesh Yadav in raising the same concern? It is the Raza Academy of Mumbai, which says that, which have apparently issued a fatwa against people who are going to undertake vaccine. So this is very unfortunate. It reflects the archaic and a medieval mindset of a political leader who has absolutely no faith in science, who at times say
So
that
you're not displaying scientific temper, Rajiv Rai.
From various colleges. So, but this is
Marya,
unscientific, Marya. This is point blank
certainly will not
unscientific period.
display the scientific temper when you make a statement कि radar में बादलों में radar में aircraft छुप गया. It does not. We don't want to be that much of scientifically aware of where we say नाली के गैस से चाय बना लिया. We don't want to be. Don't want the whole world laugh at us when we do the chest thumping.
Sir, please don't kill the spirit of innovation. Please don't kill the spirit of innovation by making this baseless statement, sir. No. You should be, please be careful on when you are about to make a statement on a national television like this. You are insulting the spirit of innovation of each and every Indian by saying this. So please don't do that, sir. Instead of welcoming the decision of the research fraternity,
Why are you talking about some wild theory?
You are doing this. This is a great disservice to our scientific fraternity, sir. Please don't indulge in that.
No, why should a vaccine be called a BJP
You are
vaccine?
comparing.
or a or a particular
No,
political party's
my
vaccine.
reply to the gentleman who was talking about our scientific temper. He does not have any moral authority to speak about the science. He does not have any moral authority to preach others. When our Prime Minister himself speaks like this. Do you agree, Marya?
The Drug Controller General of
Do you agree
India,
what his statement he made?
Drug Controller General of India, should his words not be taken seriously? Dr. Guleria, Dr. V.K. Paul, these are senior people who understand science much better than you, certainly, sir. Should their words not be taken seriously? Rajiv Rai.
No, we are not questioning any scientist. We are not questioning. In fact, we are proud of our Indian companies and Indian scientists. Let us make it very clear. Let there not be any false narrative to be propagated here. We are proud of our Indian scientists. We are proud of our Indian companies. Our concern was the kind of delivery system and health system works under the BJP government, in particular UP. I requested you some time back. Tomorrow, same time, if you want, I'll sit here. Please send your reporters in my area. I am giving you on national channel the name of Gazipur, Balia, Mau, Azamgarh, Gorakhpur. You see there and see how they will deliver.
Okay.
There is no arrangement on the ground.
Guru, respond to this.
By Yogi,
you know, for every statement being made by them, the question is,
what is the scientific relation between Makar Sankranti and vaccine? What is the scientific relation?
Can there be restraint on part of political leaders of the BJP also?
No, Marya, you know, there is a flashback, and if you would remember that before the rollout of the polio vaccine, similar concerns were being raised by orthodox forces and unscientific thinking political parties. So there is no point in debating over this. Like you yourself said, Mr. V.K. Paul, Mr. Guleria, they are subject experts. They know what they say, unlike the Congress party or section of other opposition parties. You see, the absolute problem is that they have no vision, they have no imagination, they are desperately seeking out issues, and they probably want to strategize something on these lines, and I'm sure they're going to fail in this as well.
Is this
a
opposition for opposition's
This is a very momentous moment in the history of our country, in the life of our country. With open arms, we should welcome and we should applaud and commend the research fraternity and the scientific community of the country.
Why the data is not being published? Why there is lack of transparency? If we call ourselves a developed country and we take
all
lot of
those
pride in
scientists
our
are
scientific
anti-national,
community, we should come forward with this. And these are the corrective, because this concerns every human life. I don't know why my friend is trying to blame opposition or a community or what was the opposition to chickenpox and all. In every society, these are the challenges, and these challenges have been tackled by same set of community leaders. So to blame, I think, would be complicating these kind of issues. Key point here is who started this whole business about politicizing vaccine? Who raised this issue that in Bihar there will be a free supply? It was the Finance Minister of India who said it at the party release of her party manifesto.
Yes. Guru, that's a criticism that the BJP will continue to face about free vaccine dole-out that happened.
Now because of Bengal election, this is happening.
No. You see, you are mixing politics and health over here. But let me be very clear here that health, in terms of Constitution of India, is a state subject. The Congress party, my dear friend, is free to make such announcement, or any other political party ruling any other state. Considering the situation in Bihar, it was our government which was forthcoming in realizing that probably we would need the vaccine, and hence the announcement. So there is no point in doing that post-mortem now, because that is done and dusted. Bihar elections are done and dusted.
But certainly,
there is a subject expert committee
win
which
Bihar only because of that vaccine announcement. That is also a truth in that. Thank you so much for joining us, Guru Prakash, Rashid Kidwai and Rajiv Rai. And earlier today, I spoke to Niti Aayog member for health, Dr. V.K. Paul, who says the actual rollout will be soon. But it is a strategic step as a second line of defense, because none of the vaccines have cleared all the trials. The rollout will be done in a strategic manner, in the manner of a clinical trial. I'm leaving you with this. Thanks so much for watching. Joining me now is the member health of Niti Aayog, Dr. V.K. Paul. Dr. Paul, thank you for your time. Now that 2 vaccines have been given the nod for rollout, can you give us a date when the actual vaccination will start in India, sir, and what will be the cost?
Well, we can say at this point in time that the most significant rate limiting milestone has been achieved yesterday with the licensure to 2 vaccines, and now the processes of quickly procuring them and moving them down the cold chain to the people, to the district would begin. We would first mobilize the vaccine to our major hubs, which are the government medical depots in about 30 to 35 locations, and then it will be picked up from there to the state. So, there is a time to be elapsed for this work. Similarly, from that point onwards, once the vaccine reaches at the district level, there will be some lag in terms of preparing the micro plan specific to the vaccine. We already have had a dry run, as you know, and the rehearsals have taken place. But once the vaccine arrives, it is a real situation, and some time would elapse in that regard. So, I would say at this moment that the actual launch and the rollout would start pretty soon. Wait for the announcement for the specific date that could come in the next few days.
Okay, and what about the cost, sir?
We have said that resources are not a constraint. The Honorable Health Minister has clearly indicated that for the 3 crore healthcare workers and frontline workers, the cost would be met by the government. We should keep these announcements in mind, and further decisions and further clarity about this will come forth in time to come.
Okay, Dr. Paul, there is big criticism over approval of Bharat Biotech's Covaxin. Opposition parties are also raising questions. What we wish to ask is this, sir. Why did the government rush to approve this one when phase 3 trial results are still pending? And does this somehow not undermine our vaccination drive and the fear that's emanating from this process? And can India defend this internationally?
Well, yes, India will defend internationally, and let me explain why and how. Remember, we are faced with an emergency situation. Licensure for Pfizer, Moderna, Covishield, these are all emergency decisions or emergency provisions. None of them have completed the fullest of the clinical phase 3 trials, which are still going on. But yes, at a certain point in time, it is visible that the outcomes are better with the vaccine, and it is evident that there is immunogenicity and there is safety. Remember, these are all emergency provisions for restricted use. Under that rubric, the decision taken for Covaxin comes from 1 or 2 important dimensions. Firstly, we have this vaccine which has an inactivated virus, and when this vaccine is injected into the body, this excites highly effective immunity against multiple antigens of the virus surface, unlike other vaccines which excite immunity against only a single antigen point, namely the spike protein or S protein or its components. So, it has the possibility of exciting a multi-pronged immunity in the person who receives it, which means that even when mutations hit the virus, it will be still in all likelihood survive its effectivity for a very, very long period of time. It is very distinct. And in the wake of the mutations, a scary mutation that occurred in UK, and you may remember that 10 days ago there was so much of panic, all
That's
of
right.
us were panicked, media was in panic, that we could lose the hold on a vaccine. Having learnt from the lesson, and this particular variant is there in our country, and there are other variants happening all the time. Now, therefore, you have a special weapon in your arsenal, which other countries do not have.
Dr. Paul,
Okay?
one view
So,
was...
you have this vaccine which can withstand mutations. Let me complete this. Which can withstand mutations, and therefore, what we have done is that emergency authorization in a special circumstance has been given to it, so that we are all ready to use it if the need arises. And remember, there is a conditionality, further conditionality,
Right.
that it will be used in the wake of mutant situation. Also, it will be used in a clinical trial mode after proper consenting and a proper follow up and proper measurement of outcome, even as the clinical trial will move on and will be reviewed. So, this is the whole context that needs to be available.
Fine.
Yep.
So, one view was that you could have just waited for a month. It was just about a month because the phase 3 trials would have completed by January end.
Well, remember, if you have a choice, you want to exercise this choice now without compromising the safety issues, without compromising the scientific principles. You want to be ready. The speed with which you are ready is also important. In hindsight, if such an outbreak would occur, would you not say, why did we not prepare it well? Why did we not keep this weapon in our arsenal? We have made this strategic choice. It should be seen as a smart strategic choice to ensure vaccine security of a very different level, in addition to the standard Covishield availability of vaccine. So, it is in a way a second line of defense for us, but it is available to us to be used if the need arises in a certain way according to an SOP.
Okay. Even for Oxford's vaccine, why haven't you made public the data based on which approvals were given? Because that's what some members of the scientific community are saying. Some are also suggesting, sir, are we now going the China or Russia way?
Well, let me answer the first part first. It is my understanding that all the data in pertaining to decisions that are made by the DCGI is indeed put in the public domain, and it must be there for a matter of time. I know that in the past data are always provided in the public domain. To my understanding, that's a norm. So, let's wait for it. Secondly, we are not the China and the Russian way. Remember, what they did was very different. Phase 2 done, phase 3 not even started, more or less, and you start giving it to everybody as if it is a licensure for everybody. We are different. We says we will invoke this particularly in the presence of mutants if they appear, and we have had one scare. So, we are ready for that, A. B, we will do it in the clinical trial mode where we are monitoring in a different way. So, these red lines have been imposed. It is not a free for all usage as some of the other countries took upon themselves. And the clinical trial goes on and the decisions will be made. So, we actually have done a strategic choice. You should appreciate this, because the country has kept in reserve alongside a major vaccine, a vaccine which is at least is willing to excite protection in a safe way and is available to you should the need arise.
Which are the other vaccine makers that the government is seriously considering? Will Pfizer also get the nod, and will you give them legal indemnity, and if yes, will it not open a Pandora's box?
One by one. Firstly, Pfizer have applied. They have not yet turned up to make their presentation to the regulator. Their application will be considered on its own merits, and we welcome other vaccines coming into the country. But our understanding appears is that Pfizer has very little capacity to offer at least for the next 6 months or so. But this question actually we should be directed to Pfizer, but for our doors are open. Secondly, this issue of what was your second point?
Yes, will it be given a nod, and what about legal indemnity?
Okay, legal indemnity is an issue which needs consideration. This nation has not been offering legal indemnity so far, and that is a situation as of now. There are reasons for it because it is offered. Reasons are being offered. These are under the radar and the consideration of the government, but as of now, we do not offer any legal indemnity, and we do not go that way.
Dr. Paul, this is a question that is on everybody's mind, I would say, today. When do you think India will have vaccines available in open market? This would certainly allow people who can afford to can buy it from the market, and hence reduce the government's burden. Is the government thinking on those lines?
Firstly, remember, Marya, this is a situation where there is a limited supply of vaccine. Even when we are talking about millions and crores of doses, remember, for a nation of our size, This is a limited supply. In the presence of a limited supply against a much larger demand, if the government does not step in to invoke public health approach, there will be a melee, there will be black marketing, there will be other issues that will come up because the overall supplies are limited. Remember that. We are struggling to ensure that the priority population of 30 crore or 300 million people is first immunized. That is the priority of the country, of the society, of all of us. And therefore, the government has intervened and say, we will make sure that we do it so that we achieve the priority public health objective. Availability in the private sector can wait for a while, but it will happen eventually. It is a function of availability, function of stockpile, function of plethora of vaccines which have enough numbers in terms of doses to be fulfilling the public health objective as well as an open space availability. So, right now the whole focus is that in the face of shall we say limited supplies, we want to make sure that India as a whole vaccinates people who need it the most and makes the maximum possible public health impact. That is the priority.
Yes.
When it appears that there are supplies beyond this, there will be no issue.
Since you talked about the priority group, my question is now, sir, 3 crore out of 30 crores who will be vaccinated will get the vaccines for free. What about the rest 27 crores?
Wait, there will be communication on this. We started the process. The country is committed to vaccinate the priority groups, and we should let the government take a final decision and come up with the decision and the announcement.
Last question to you, Dr. Paul. Will the worst affected states like Maharashtra, Tamil Nadu, Kerala get priority in getting larger share of vaccines?
Well, remember at this point in time, the pandemic is more or less settled in most parts of the country. The important part is that the priority groups are scattered in every state. We will find a way based on the exact situation how this is to be distributed, but essentially this is to go to every state that needs it. When the states have the stockpile available to them, there is a way of prioritizing certain populations, certain districts, certain ways in which this can reach the people who are most needy. I think it is a matter of detail, but in principle the whole effort is pan-India. The principle is that we are going to work toward eradicating the adverse effect of this pandemic and eventually the pandemic itself through our vaccination program over the next months to come.
All right, Dr. V.K. Paul, always a pleasure to speak to you, sir. Thank you so much.